One of the common procedures that we do here at Wave Plastic Surgery is rhinoplasty. So what is a rhinoplasty? Rhinoplasty is a surgery that involves manipulating the nose to reshape it and balance so that it matches the rest of your face. There's commonly two reasons why we're doing a rhinoplasty. Either the nose overall is too large or the nose is too small. So we call it a reduction rhinoplasty versus an augmentation rhinoplasty. A reduction rhinoplasty typically involves making an incision at the base of the nose as well as internally inside the nose. And we want to reduce the hump that typically a lot of people have at the dorsum. We also want to actually narrow the base of the nose as well. And at the tip region, what we want to do is we want to increase the projection slightly, but also rotate the tip up slightly. For an augmentation rhinoplasty, we're actually adding an implant or a cartilage at the dorsum to give it a little bit more of definition. Similarly, at the tip, we're using cartilage to increase the tip projection. The rhinoplasty surgery typically takes about 2 to 3 hours to perform. We can do it in either under an IV sedation with local anesthesia or general anesthesia. It really depends upon the patient's preference. After surgery, it's really not painful. Typically, there is a cast and tape that we apply on the nose that we remove after 1 week. At 2 weeks, we remove all of the sutures. And for most patients, that's when about 70 to 80% of the swelling does go down so that they look more natural. In the past, surgery was really the only way to address the issues involving the nose. However, now we do use fillers on the nose to create and shape the nose structure so that it mimics the surgical results. For reduction rhinoplasty, a lot of times what we're doing is that we're trying to make the dorsal area a little bit more straighter. Those patients with large dorsal hump, we inject a little bit at the top of the nose as well as in the bottom portion of the nose so that the side profile looks much more smoother and straighter. For people seeking augmentation rhinoplasty, we're adding the filler throughout the entire length of the dorsum and giving them more projection at the tip. So for those patients that's not quite ready for surgery, liquid rhinoplasty is really a good option.